Dear chairs, ladies and gentlemen, it's my pleasure to be here talk and new factors in the control of glucose. Well, it's well known. The mechanisms of glucose regulation, including iron cell producing insulin and glucagon, and the feedback loops. Well, recent years, it is found so many factors also involve the process of lowering or increasing glucose. So in this period, I would like to talk some data from our lab. First one, the cloning and the function study of TM4. What's the TM4? This protein contains 4 transmembrane domains, so we call TM4. Well, TM4 SNP study shows the TM4 associated with obesity. Well, TM4 was downregulated in the human, the visceral fat in the patient with obesity. And TM4 knockout mouse appears hypertension, high glucose, obesity. Well, the low-grade inflammation in the liver and adipose tissues. TM4, the regulate NUR77 IKK beta. Also, TM4 can decrease appearance of atherosclerosis. So looks TM4 as a very good model induce diabetes, obesity, fatty liver, and atherosclerosis. Second protein we call EMC. This is secreting the proteins, which was significantly increased in the muscle or in the muffled patients. Well, it was found that EMC10 is involved in occurrence of muffled. Also, inhibit muscle GLUT4 activity and glucose uptake. So it was considered EMC10 is a type 2 diabetes glycemic factor. Well, since EMC inhibit first phase of insulin secretion, we also demonstrated that EMC10 inhibits insulin secretion in pancreatic island beta cells. We also demonstrated that the serum EMC10 was positively correlated with obesity. And promotes occurrence of obesity in the mouse. Well, another data is about LPS and microRNA. Well, plasma LPS was significantly high in the newly diagnosed patients. LPS decreased the transcription of microRNA 143, 145 cluster. microRNA 145 degrees NF kappa B activation. Well, so that we understand LTS can come from disbalance of gut macroorbital. The LTS induce macrophage polarization by inhibiting microRNA 145. So what? The bind to macrophage receptor, toll-like receptor 4. Then they inhibit microRNA 145 promoter. Then they increase OPG and KLF5, which activating N-kappa B induce low gradient inflammation. Well, another factor is adiponectin. So this is another group found. The adiponectin related to type 2 diabetes, atherosclerosis, obese, and muffled. We found adiponectin in the human visceral fat was reduced. So, adiponectin actually is the co-occurrence of type 2 diabetes, atherosclerosis, NAFLD, and obesity. Another one is isazomine. Is actually can reduce random blood glucose, fasting blood glucose, and HbA1c. Improve glucose tolerance. Isazomine also can increase insulin sensitivity. Of course, they increase systemic insulin sensitivity. So last one is inflammatory factors. So based on the above factors affecting the glucose regulation, so we propose metabolic inflammatory syndrome called MIS. Well, we can understand LPS bound to macrophage receptor, toll-like receptor 4. Then macrophage polarization. So this macrophage enter the vascular, induce atherosclerosis, then enter the island, they induce type 2 diabetes. So if the patients with 2 of above 4 metabolic disorders, it was considered as metabolic syndrome, metabolic inflammatory syndrome. Well, first call inflammatory disease is atherosclerosis. About more than 20 years ago, it's published in the New England journals. Atherosclerosis is an inflammatory disease. Well, actually, macrophages involve the whole process of atherosclerosis, including thrombosis. So, from our lab data, we found that the factors are hypoglycemic and anti-inflammatory effects, including TNF4, microRNA 145, adiponectin, isosamine, PS341. Well, LPS and EMC10 lowers glycemic and induce inflammation. So based on our finding, the factors affect glucose. So we propose metabolic inflammatory syndrome. So we suggest that the integrated prevention and the treatment of 4 metabolic disorders, including type 2 diabetes, MAFO, obesity, and atherosclerosis. We just start a clinical trial, random clinical trial. We hope get more better data, integrated prevention and treatment of 4 metabolic disorders, including type 2 diabetes, MAFO, obesity, and atherosclerosis. Well, thank you very much for your attention.